Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet nurse practitioner Jenny Blevins of the Novant Health Express at Walgreens in Leland. And then we'll meet physician assistant Katie Johnson of Novant Health Oceanside Family Medicine and Convenient Care. And finally, we will learn more about the new Da Vinci surgical system at Novant Health Brunswick Medical Center with Dr. Andy Smith. So stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome nurse practitioner Jenny Blevins of the Novant Health Express at Walgreens in Leland. Jenny, thank you so much for coming today.
Thank you for having me.
It's a pleasure. I'm really excited to get to know you. We've only met briefly, and I can't wait to learn more about you, and I know our audience is going to be really excited too. So, I know that you're new at Novant Health Express at Walgreens. That's our newest venture. So first of all, let's talk about you. Tell me a little bit about your education and your background.
Okay. So I started out as a lab technician, right out of high school, not long after that. I was a lab technician for about 10 years, and I always just kind of knew I wanted to be more towards the patient side. I enjoyed that part of healthcare. So after about 10 years, I decided to go ahead and
10 years as a lab technician?
Yeah, long time.
Wow.
And went on back to school to be a registered nurse. And from that aspect, I had a lot of good colleagues that I worked with, just inspired me to keep going, to do more. And so I finished my bachelor's degree and my master's degree for my nurse practitioner, and finished that in 2016. And I've been a nurse practitioner since.
Where did you go to school?
So I started as a bachelor's. For my bachelor's, I went to Old Dominion University. Mm-hmm. And for my master's, I went through Waldron University for that.
Wow. Well, that's great. That's a long way from a lab technician
Yes.
to a nurse practitioner, because nurse practitioners can do so much. It's
Yes.
quite an interesting career. So let's talk a little bit about the Walgreens thing that we're doing, the Novant Health Express at Walgreens.
Yes.
So how is that going for you? Do you like that?
It's new still. It is a new venture, and it's so exciting because we have the opportunity to serve so many more patients with those hours that are extended there. Mm-hmm. And we're affiliated with the Novant Health Oceanside practice, but we also see any patient. They don't have to be a Novant Health patient for us to see them. And it's just a really good service to the community, I feel, especially in the area that we're at, to provide medical care.
Okay. So you touched on a couple things I want to talk about. First of all, am I correct? You do not need to be a Novant Health patient in order to utilize the Walgreens.
No, you do not have to be a Novant Health patient to utilize that site. Mm-hmm.
And what value does being associated with Novant Health Oceanside Family Medicine, what value does that bring? Does that give you extra resources? Or?
It definitely gives us extra resources that we have available to us. It also helps us to do more imaging, things like that. So if we have a patient that comes in for an extremity injury, we can send them to that facility during their office hours for x-ray services and that kind of thing too. We also provide the Novant Health Oceanside Family Practice. We're an extension, so we have extended hours for them too.
Oh, yeah.
But we serve all patients. I mean, they don't necessarily have to be a Novant Health patient to even come to us. And it's just exciting for the new venture. I think where this is a new thing for Novant to provide medical care in like a retail space, to see if we can think more out of the box.
Right.
And
well, you take the health care to the people. I mean,
yes.
That's how you grow, to get it to the people. Transportation is an issue in this area, and so where you're located, now you're located on Village Road in Leland.
Yes, that's correct.
Old side of Leland. And so there's not a lot of bus transportation, and so for the people living in that area, it's very, very nice.
Yes.
So do you take walk-in patients?
We do accept walk-ins. We work them in as we can.
Oh, okay.
We also have appointments that we have as well. So either way is fine. You don't necessarily have to have an appointment to be seen.
Okay. And what days are you open?
We are open 7 days a week, so that's exciting. We have extended hours, so Monday through Friday we're open from 10 to 8, and then on Saturdays and Sundays we're there from 10 to 3.
So, Jenny, that's really interesting, and those are great hours because oftentimes kids are sick on the weekends and they can't get into the office, so they can bring their children, or they can come to the express care and
absolutely
and get treatment. Now, I assume that you're on the same EMR as all the offices of Novant Health. So
yes.
You would be able to access all their records, correct?
That's correct.
That's really
It definitely
good.
helps provide continuity of care.
Yeah, so. Absolutely. Well, what kind of services does the Novant Health Express Care offer?
We're unique. We're basically kind of like your urgent care. We can do everything from suturing, laceration repair, wound INDs, to your basic sore throat, any kind of extremity injuries. Really? Basically anything that you have a problem with that same day. And if for some reason we can't fix you, we'll make sure we get you to where you need to go.
Great. So if I'm fishing and I get a hook in my finger, that's the place to go, right?
We can definitely help you.
Because there's a lot of that around here.
There is a lot of that around here. That's challenging.
I'm curious, do you offer COVID-19 testing?
We do offer COVID testing. We do not offer the rapid testing.
Oh, you don't? Okay.
No, our site does not offer that. We do offer the COVID send-off testing through our LabCorp resource or reference lab. And we have a very good turnaround time for that.
That's pretty
too.
quick.
Yes, it is quick. It definitely is quick.
I've seen it as little as 24 hours. Or
yes.
Sometimes
we're seeing, 24 to 48 hours for the most part. That's about the average.
Yeah, well, that's encouraging too. Well, tell me a little bit about yourself. Are you new to the area?
We moved here in 2016.
Oh, really?
Yes, so we're kind of still new, learning things, that kind of thing as well. This has always been a dream for us to live coastal. We have 2 children, and they are older and out of the house, so we are now empty nesters.
Oh, nice.
But we're excited to be here because this was our dream. To be in this area, this is just our dream.
So you've never lived here before?
No, we came here to visit quite often.
That's how a lot of people get here.
Yep, and always knew that when the kids got out of the house and doing their own thing, that this was something for us.
So you moved here from the Mooresville area? Or?
We moved from the Mooresville, Lake Norman area to here.
And that's a really nice area.
It is. We left the lake for the beach, and that's a great option.
So you knew about Novant Health coming from that area because there's so many practices there, right?
I worked for Novant Health previously as a nurse practitioner in the Salisbury area. Nice. And just so happy to be back and doing good.
Well, we're happy to have you here. We're really excited about this new Express Care at Walgreens. That is a new venture for us here. I know that they had started that in some of the other markets, and I was surprised when, I knew it would happen eventually, but I was surprised that it came so quickly. But I think it's a great thing for the residents of that area, even from Wilmington and from Southport. It's not that far, and to have those great hours. What interests you most about being a nurse practitioner? What are you able to do that makes it so exciting?
I enjoy more of the patient aspect of it, teaching. Just I think a lot of times when people come into you for problems, they have a lot of questions that sometimes they don't always like to ask, or if they feel like they're not comfortable to talk to you about things. You just want to I want to educate them. Like, I want to make sure they understand what's going on with them, why I feel what's going on, why we're doing what we're doing, and things to watch for if they need something, else as far as a follow-up. I want to make sure they know these things. And education's a big thing, even for chronic health issues. I think a lot of patients just maybe don't feel like they have the time to ask a provider. And I feel like, just having that nursing connection with them helps, and we can talk more.
I think you're absolutely right. I love nurse practitioners. I just think coming from a nursing background into that, I love the way they approach patient care.
Yeah.
And I like getting that extra little time and.
I think that's what makes it unique and the best, and that's what really lets us provide that, remarkable care for them.
Do you give other vaccines at the clinic? I mean, can you give flu shots?
Yes, so we have flu vaccines, we have pneumonia vaccines, we can do the Shingrix. So those are some of the vaccines that we definitely do. Tetanus, Tdap, those things as well.
Yeah.
And for people that come in for their physicals, for either school physicals or work pre-employment physicals.
Oh, you can do physicals for like sports?
So a lot of times with that, they have to have like a PPD, a little screening test for tuberculosis, and we can do that as well. Unfortunately, we do not offer the COVID vaccine, but other areas, we have resources to lead them the right way.
And how about safety when folks come in? What precautions are we taking in the waiting area? Do patients wait in their cars? How does that work?
Well,
at the
from
Express
where
Care?
we are a very small space, depends on kind of what they're coming in for.
Okay.
Sometimes we have a little waiting area, very limited waiting area. But if they're coming in for more of a cold symptoms, we do have them wait in their car. We call and talk to them over the phone. We do a lot of the process check-in wise over the phone. So that kind of eliminates them just sitting. And when we're done with that, we just have them come on back. And we take them directly to a room. We always, make sure that we are safe in every way.
Everybody's masking?
Yes, we are all masking. Cleaning precautions, all of that is definitely occurring.
That's really good. And it's located right inside the Walgreens, is that correct?
Yes, so the Walgreens store, it's all the way towards the back. If you look up, you can see on the wall there's a big sign that says clinic.
Oh, it does?
So
does it happen to be purple?
No, it doesn't yet.
Well, hopefully,
it may.
Hopefully it will be. Hopefully it will be. So it's really easy to get into, and you're open quite a few hours. And how many staff are at the clinic?
There's another nurse practitioner that works with me, Miss Diana Ban. She is excellent with the patients, enjoys her work. She works opposite of me. We work together. And then we also have lab services through LabCorp, and they are staffed with us as well. And we will have a certified medical assistant with us.
Awesome. Well, thank you so much for coming in today, and appreciate learning more about that. I really didn't know much about it. Now I feel like I can probably talk about it out in the community. So it's great to have you. I hope you'll come back and let us know how you're doing.
Absolutely.
Right.
It was nice meeting you and being here.
Nice to have you. Thanks so much for coming. Now let's welcome Physician Assistant Katie Johnson of Novant Health Oceanside Family Medicine and Convenient Care. Welcome, Katie. I'm so glad to see you.
Thank you.
It's so nice to have you, and I can't wait to hear more about you. Want to hear about your education and your training and where you went to school and all that kind of stuff.
Yeah. So I am a physician assistant. I graduated from Emory with my degree, my master's in physician assistant studies in 2010.
Wow.
So I've been a PA for about 10 years now. I got my undergrad at UNC Chapel Hill.
Nice.
And I'm close to being a local now. I've been here for about 10 years. So.
And do you live local here?
Yep, I live right down the road in Calabash.
Nice.
Yeah.
Nice. So you're not new to the area. I
No,
was
ma'am.
thinking you, was there something though that drew you to this area? Did you grow up here?
No, my husband is from Goldsboro, North Carolina.
Oh, yeah.
And right after high school, he had worked here a bunch, and then when we both kind of went off and finished our degrees, he found a job in the area, and so we moved here for him, and then we've loved it and been here ever since.
Oh, good. Well, we love it here. I'm sure
Yeah.
you guys do. So what interested you most in becoming a physician assistant?
Yeah, I am one of those people who have always been kind of good at math and science and been drawn to those things. I feel like ever since I was like a little girl, I always felt like I would go into medicine. I initially wanted to go to medical school, and it's funny, I remember I was getting ready to apply, and my mom told me to call my pediatrician, who convinced me to switch and to look into physician assistant, and she said if she had to do it all over again, that's what she would do. And she gave me the number of her friend who was a physician assistant, said call her. She loves her job. She's so happy. I think that would really be the route for you. And I totally agreed and have been delighted. I think it's been a good choice for me.
Wow, I was wondering why you didn't go to medical school when you love medicine so much.
Yeah, and I do. It's a great fit for me. I really enjoy it. I get, checks all my boxes. So, yeah, it's good.
Yeah, and it seems to be trending now. Both nurse practitioners and physician assistants seem to be the way to go now.
Well, I mean, and different strokes for different folks, but
Exactly.
there are not enough healthcare providers in this country, and
Correct.
so I mean, PAs and nurse practitioners are really filling a gap, and
They are, and they've been awesome for Novant Health. We love them. What do you enjoy most about being a PA?
I think I enjoy kind of being able to help people, being part of the community, getting to know my patients. I think medicine is fun. I love to learn. I love to grow and help people and treat people, make people feel better.
So you just kind of like the whole thing.
Yeah, I do. I'm a kind of happy-go-lucky person too, so yeah.
Well, let's talk about the types of services that we offer at Novant Health Oceanside Family Medicine and Convenient Care, where you're currently working. I know they do lots of stuff, so tell me about the types of services.
Yeah, it's great. It's a big family medicine practice, and there are a lot of things are offered in-house. Right now, in the kind of COVID pandemic, they do have a respiratory care center. So if people need COVID testing, they have COVID testing there. If you have any kind of acute respiratory complaints, you can be seen and treated in the respiratory care center. They also offer in-house lab, x-ray, bone density scanning, ultrasound. So lots of things in-house that we do.
How about procedure-wise? Do you do many procedures at the facility?
They do. They also have a convenient care. So if if you need stitches, we offer stitches. Some of the providers do like skin biopsies, things like that. We can splint things if you have an acute fracture. Other different providers offer other different procedures. We do GYN services, some women's health stuff. So
are you taking new patients?
Yes, ma'am, I am. I've been in the area, like I said, for a long time. I was practicing at Grandstand in cardiology and electrophysiology previously, but I'm new to family practice. My schedule's wide open. So
that's awesome. Will you see children?
10 and up.
10 and up. Everybody has a different, some are 3 and up, some are 7.
Yep.
So 10, you're more
For me, yeah, but the practice sees all ages.
I know they see children there, yeah, absolutely. Do you have any particular focus or specialty that you prefer?
I, have a lot of cardiology experience.
Yeah, I guess you do, yeah.
Yeah, so I think that's one of my strong suits, but, like I said, I love medicine. I don't think otherwise I have any other particular specialty or interest or anything.
No. I know with COVID, things are a little different. People are nervous about coming in. What would you say to patients who were putting something off?
Yes, I think that is a huge problem, and I understand people's hesitation and trying to do the right thing and stay safe, but avoiding medical care is not, in patients' best interest. If you're sick, we can safely treat you. People are screened for fevers at the door. We ask, screening questions. Like I said, we have all of people with respiratory complaints are kind of quarantined off in the practice, so they are in a separate area, so patients without those complaints can be safely seen. We do telehealth visits right now, so if you don't want to come in, you can still, be evaluated and checked out and cared for.
Yeah, that's really nice. I like that. What's your advice to folks debating whether or not to get the COVID vaccine?
Yeah, I think I would 100% encourage people to get it unless you have some, specific reason that you cannot get the COVID vaccine. I've been encouraging everyone to get it. These new vaccines are really exciting for healthcare. They've been shown to be safe and effective, and the quicker we can get people vaccinated and safe, the quicker we can stop wearing masks and get back to a little bit of more normalcy in our daily lives.
Yeah, and they should really discuss it with their physicians.
Absolutely. Any questions, just call and ask. We're all happy to talk about it.
Great. Well, thank you so much for coming today. It's been a pleasure to meet you.
Yes,
I hadn't
you're very welcome.
had the pleasure yet, so this was a great start, and I look forward to seeing you back.
Very good. Thank
Thanks
you
so
very much.
Now, let's welcome Dr. Andy Smith of Novant Health Surgical Associates. Dr. Smith, welcome back.
Hey, June, it's good to see you again.
Great to see you. Many of our viewers, or most of our viewers, know you by now, but it's always nice to remind them of who you are and where you went to school and a little bit about your background.
Oh, sure. Well, I grew up in East Tennessee. I went to college, undergraduate at the University of Tennessee in Knoxville, medical school at the University of Tennessee, which is the medical school campus is in Memphis, Tennessee.
Right.
So 4 years there, and then did my training in Wilmington through the University of North Carolina, and ended up back here.
It's sort of a circuitous route, but we're glad to have you. So tell me a little bit about Novant Health Surgical Associates.
Sure. I joined the practice almost 4 years ago this coming summer. There's 5 of us practitioners in the group, 5 general surgeons, Doctors Tillotson, DeSandre, Scallion, and Beninati, and myself.
Well, speaking of Dr. Beninati, we had him on a few shows back, and he talked about the new Da Vinci robot at Novant Health Brunswick Medical Center. And so I wanted to hear your view on the benefits of the new Da Vinci robot.
Sure. Currently there's 2 of us in the general surgery group who are using the robot
robotically trained
for procedures that are robotically trained, right? And there is an additional training that goes along with that. Dr. Beninati and myself, and of course he's doing a lot of similar operations to what I do. He also does a lot of foregut, which means anti-reflux surgeries, hiatal hernia repairs, and things like that. That is really his area of particular expertise. For me, I do a lot of hernia repairs and colon surgery with the robot.
He happened to operate on a good friend of mine, and with using the robot, and she did amazing. The recovery was so simple for her, and I just can't say enough about that. So what type of procedures do you offer? Let's talk about the kinds of procedures that you offer.
So when you think about the robot, I think it's important to really outline why do we use the robot? Why is it better than open surgery or laparoscopic surgery?
Right.
So the benefits of the robot are smaller incisions, faster healing time, less pain, less hospitalization, shorter hospitalization stay. In general, when we think about the robot, you think about places that are hard to get to with your hands, right, or even laparoscopically.
Yeah.
So places low in the pelvis, places up under the diaphragm, and then you think of ways to save incisions and make incisions smaller and less numerous when you're doing an operation, and that falls into the hernia repairs and colon surgeries. Some of the other benefits there are less risk of infection with robotic surgery, less risk of blood loss, and in some situations with certain procedures, better outcomes overall. So the robot is here to stay, and it's really become a staple of general surgery.
How do you, when you talk to a patient about having robotic surgery, is there a language that you use? I mean, even when they see that robot and you're sitting over there,
Sure.
how does that, how do people take that?
So a common question is, are you really doing the operation or is the robot doing the
Exactly.
operation?
I don't want to
right?
say that.
I think the best way to describe it, the robot is essentially a computerized device that assists the surgeon. So the surgeon is doing the operation. The surgeon is in the room. The surgeon is right beside the patient. We simply are using the robot to create an enhanced amount of visualization, dexterity, and precision that we're unable to accomplish with laparoscopic procedures alone.
I'm curious. It sounds like a great tool and it works really well. Are there times when it's really not the best way to go? The old-fashioned way is better?
Sure, absolutely. Emergency situations oftentimes are not a good choice for the robot. Some of them are, but every surgeon's going to have to look at each procedure, each situation, and make that decision. We all have our understanding of when the robot's a good choice and when it's not a good choice. And it's a conversation we're going to have with the patient every time. That's something we discuss. You ask about that. We do discuss, here's why I want to use the robot. Here's why I think it's a good option for you for this particular situation. What we've found is that most patients are very receptive to the robot and very appreciative of the robot when it's involved in their care.
As I said, I did witness some of those benefits that you spoke about with this friend of mine, and she's just crazy about it. She thought that was the best thing because she had had surgeries in the past, and the recovery just was difficult. And this was this was much better.
Yeah, particularly I think one thing I'm seeing is, as I said, colon surgery, so colon resections, whether it's for diverticulitis or for colon cancers and things like that, and hernia repairs. My patients in general do extremely well, have less pain, faster recovery, fewer incisions, and lower risk of some of those things like we talked about, infection and blood loss. So it's a great tool, and I think it's here to stay.
Well, I understand that there is a new robot in town, right?
That's right. It's been here for a few months now. Quite an expensive piece of equipment, but we're really happy to have it.
And brand new,
And
right?
brand new. It is literally the cutting edge, top of the line. It's called the Da Vinci Xi robotic platform. It's phenomenal. It does a lot of things that the previous generation robot, which we had before, and most hospitals still have, did not do. So it's really just taken that ability to do things robotically, which was already enhanced, and elevated it even further. So just the way that this robot, the additional options that it provides to us when we're in the operating room is phenomenal.
That sounds awesome. I'm just so happy for you and for the hospital. I think that's a great thing for our patients.
Yeah, I think for the patients of Brunswick County, it
amazing.
provides top level, cutting edge care right here at Novant Health in Brunswick County.
Right. Are you taking new patients?
We are taking new patients all the time.
All the time.
All the time.
That's great. Well, it was a pleasure having you back on the show, and I look forward to you coming back again and telling us all the new stuff that's going on.
Absolutely. We'll see you next time, June.
All right, great. Thanks. Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
This is ATMC TV, your community channel. ATMC TV is your community channel, bringing you the best of where you live. stories about local people and businesses, staying fit and living well, coverage of high school sports, and the area's only local cooking show. Tune in to ATMC TV, your community channel, only on ATMC Cable, Channel 3 and HD Channel 910. Watch online at atmctv.com.